Hello, everybody. Hello, Europe. This sounds like the European Song Contest almost. Let's not go there. My name is Heikki Pilvinen. I'm a dentist. I have an MBA from the Helsinki Business School of Economics. And I'm the father of the revolutionary new concept that we are going to show you. This is Christopher Nordström. He's the CEO. I have the ideas. He does the math.
Hello and welcome from my part also. So we're going to tell you about the concept we have developed, Mega Revolution, and we come from a company called Mega Clinico. Founded in 2010, we are a health technology company. Currently, we are operating our own dental clinic in Helsinki, consisting of 18 treatment rooms. And this year, we're also going to open our next clinic in Stockholm. In addition to this, we are also using our system in many cities in Finland, many municipalities. And we're going to tell you later a bit about the case studies of a city of Jyväskylä in Finland, how they achieved efficiency with our processes and systems. A bit on the volume, we have over 160,000 visits to this day since 2010, treat about 30,000 visits a year. To put it in perspective, but as said earlier, Finland is not a very large country, but still this is some volume in Finland.
In the heat of the discussion of modern technology, and we've heard this morning so much of the new inventions that we have forgotten one important thing. The fact is that if we look at the 3-4 decades before this, what has happened in the world, when digitalization and IT technology came into car industry. In the beginning of the 80s, it took 3 days to build a car. At the end of the 80s, it took 3 hours. We all know what happened in the banking in the 90s. Look at agriculture. The only area that has been untouched for 300 years is the medicine. We still have the same process. We still book our appointments 3, 4, 5 weeks ahead, and we predetermine the length of that appointment. So when it comes, it's always wrong. We have analyzed 150,000 procedures or treatment procedures, and only 1.5% of these procedures is exactly 30 minutes of length. So we have either slack or we have stress. This is what leads the whole medical community into ineffectiveness, and it costs us a bundle because we cannot optimize our flow. One more thing, we do everything. We have our apples and berries in the same basket. But if we look at, let's say, the dentistry in the world, 80% of the procedure go within 32 procedures. That means 80% of everything that we do goes into 32 procedures. If you look at orthopedics, big hospitals, we still have recurring things. But if we put everything in one basket, we never can control the system. Christopher, continue on the...
Yes. What we have done is, with this so-called bulk, the big, vast majority of standard procedures, we have rationalized it, changed the delivery process. If you look at the traditional process, this is a sample of how it can be viewed either in dentistry or any other health sector. We have the booking. We call our dentist or doctor on his or her terms. They give us the time, 2-3 weeks, 1 month in advance. We know, okay, we have the 30-minute window. We go to visit the clinic and we get the 15, 20, 30 minutes treatments done. Most often, this is sufficient for a checkup. We cannot actually do anything. We need to rebook the next time. And this is due to sub-optimization. Because the doctor's time is so valuable that we cannot afford a cancellation or any other changes. We need to sub-optimize into these 20 or 30-minute slots.
Imagine us calling surgery and saying, hello, this is Mr. Adams, I'm a new patient. I would like to book a 2.5-hour appointment with Dr. So-and-so. Well, now we're all laughing, because that's an idiocy. We try to sub-optimize. So you give 50 minutes, then you check up, then you rebook, and the bigger the volume, the longer it takes, the more inefficient it is. The whole treatment period with this method tends to be longer and longer the bigger the population is. Like some municipalities in Finland have 6 months of queue.
For the first treatment. And after that checkup, it's another 6 months for the actual procedures. And in the dentistry, if we then need hygienist visits, it's another 6 months. So this single treatment episode can be up to 1.5 years easily. And this is just not in Finland, but it's a common thing all over the world.
And if you book at a certain service provider and he or she is sick, what happens? The whole day is rescheduled and you go on again. So it's the same folly as if I would need a haircut, I would have to fly to Paris to Vidal-Sassoon. Well, these strands could be managed by some gentle hands. And this is the key thing here. We have to do what we do effectively in bigger clinics. Let's say that you need a knee operation. We all know that somebody's recommending Dr. Jones, Dr. Smith, and they're good. But if we look at the system, how it's working now, some surgeons do 30 backs, 50 knees, 2 shoulders. I would like to go to a guy with my sick knee who does 600 knees a year only, because that's the best way. So also in the special care, we need to concentrate, be effective in what we do.
So, just to clarify with a simple example, we have here the standard dentist's day. It's a schedule 8 to 4, and we have there 14 openings, 14 bookings, 14 patients. Everyone needs to have a break, so there's 1.5 hours of lunchtime. This gives us 420 minutes of actual clinical treatment time, hands-on medicine. However, between each and every of these treatments, we need to clean the room, be it dentistry or any other field. At this point, most oftenly when we're working in treatment pairs, we have the situation when the nurse is doing the aseptic cleaning and the dentist is not doing hands-on medicine, something else. And just this slack gives us 15% inefficiency from the dentist's actual hands-on medicine that day. Let's say we have one cancellation, just one cancellation in this day. That's another 7%. We cannot, in the standard traditional method, we cannot rebook, we cannot get in 5 minutes advance the next patient. That's not just working. If we don't have the waiting room full of patients, which is perhaps not the best case for the patients then again. As we said, with 150,000 episodes and treatments, only 1.5% is actually 30 minutes long. Here in this example, we have just 4 customers have been estimated incorrectly with 6 minutes, which we know that should be much more, but this is a conservative example, and we can see that's another 6%. So before we even start the day, the process of today has left us with almost 30% inefficient time. That's not hands-on medicine. Scale this up with your own clinics, 10 rooms, 20 rooms, 100 rooms, 100 doctors. You start getting the numbers. And this is just true to the process that has not been changed in 300 years.
Well, the customer-centric healthcare process, what does it mean? It means that we don't give certain appointments to doctor this, doctor that. Our doctors and nurses do not stay in the same room for the rest of their lives. You know that if you give to 10 nurses 10 own rooms, in 1 week they look all different. There are palm trees, there are photos, there's this, and nobody finds anything in these rooms except for the persons. So we give a time slot. You can book online 24/7, for instance, between 10 and 11, 11 and 12, 1 p.m. to 2 p.m. And our guarantee is that your treatment starts in this section. 30 minutes before you come, you will get an SMS saying that your appointment is now clear. If you book between 10 and 11, it might say that your time starts 10:14. With 35,000 patients in one shift in Helsinki, the average waiting time in the waiting room is 2.7 minutes. That is interesting per se. Our next promise is that once you come in, you will get all the treatment that you need that is possible medically and humanely to deliver. So you will get the examinations, you get the x-rays, you get the fillings, you get the hygienists, you might have the consultation of the specialist. Everything is done there in one sitting. The patient sits in one room and the professionals move around, guided by our software control system.
This is due to the fact that we do not make any pre-allocations or pre-bookings. When you come into the clinic, we do not yet know who is going to be your treating doctor or dentist. We do not know which room. When you come in and we see free rooms, our system allocates the first free room, then we know the room. When you enter the room, we have a resource call, and the first hygienist or nurse that answers that one will be the treating personnel. The same with the doctor and the dentist. So by doing this just in time, we can always operate with whomever we have available and also optimize the efficiency and flow of the personnel. So this 2.7 minute waiting time does not lead to the fact that our personnel would be waiting. Their efficiency is also way over 90% of the actual working time. So this is a win-win situation where we optimize all these different parties. And as we saw earlier, the treatment episode was 90 days plus almost everywhere in Europe. What we now have done is that we have taken it down to 1 to 2 days. You do your booking online, you come to us even the same day. Today, 50% of our bookings come in 48 hours prior to the treatment. Today, we do not know how many patients, or we do know by math how many patients, but at the moment in our calendar next Friday, we do not have any bookings yet. And this is the way the current situation what the customers want. They want it when on their terms, last minute, when they have the free opening in their own schedule. Not 3 weeks prior when the dentist says, now I have time for you.
In 5 years' time, we haven't cancelled one single appointment. And that is based on the fact that when we plan our team of daily 50 persons on the job, we know what kind of a capacity we have. We open up on the internet, on the website, only 70% of that capacity. Then, when the morning comes, we look, okay, Tom, Dick, Susan, everybody is on the job. We open 30% more new slots, which will fill in the same day. This is the hectic life that we live in. If you give a city executive an appointment 4 weeks forward, he doesn't know if he's in the country by then. And we have gone to that people say, okay, I have a cancellation and a meeting 2 hours in the afternoon. Now I want my dental checkup. Now I want my hygienist, and because I have a soiree in the evening or whatever. This is the pace. 52% of our bookings come within the
48 hours prior.
48 hours.
And this is just because it's possible. It's not because we want it, but because the customer wants it. But to give you an idea of how it actually works, we have a view here of our actual ERP system. This is a recording from last week from our clinic in Helsinki. This information is available in all of our clinic. Everyone at every time knows exactly what's going on, where all our personnel is, and what we have available. So here on the left side, we have our time slots. For example, there's 4 p.m. to 5 p.m. We have 14 customers, bookings, out of 14 openings. The green ones are customers that have already left. The light yellow ones are actually at the moment being treated. Dark yellow have entered the room, doing the initial anamnesis, etc., and the treatment is about to commence. Blue ones have been arrived at the clinic, and the lilac have been called automatically by the system. There's no one pushing the buttons for the SMS. It's the system itself that estimates when are we going to call this customer.
And the people in the slot, you see there were 14 people, they are not being called row by row. Our computer system is analyzing on the basis of what the patient has filled in the anamnestic form. We have data, so we know that, okay, this is a patient that will need 35 minutes, or this is a patient that needs 1 hour, 15 minutes. So we have so much data that we can know exactly what kind of patient is coming. So the machine can pick any patient from the promised slot that suits our flow. This is interesting.
Then we have all of our personnel here. You can see with the red ones, that's our dentists, lilac hygienists, and our dental nurses with blue. Then there's the reception and maintenance otherwise. Now we can see each and every one at the clinic, real time. When are they going to leave? Their shift is going to end. Are they on a break? There we see at the moment one person's break is about to end. And we can see in what treatment room and for how long each of our resources are at the moment estimating they are going to be in the treatment. Down here we have all of our 18 treatment rooms. For example, number 1, we can see there's a treatment in progress. We have a dentist and a nurse at the moment in treatment. The dentist have estimated 44 minutes is left for his or her part of this treatment. And the nurse is putting an additional 10 minutes for aseptic cleaning of the room. Now this is important because the dentist is going to be available for the next treatment 10 minutes prior than the room. So with scale and enough rooms and enough personnel, the dentist is going to leave, change the room, and also change the assisting pair to another nurse or hygienist that has already brought the customer into the room. So the dentist always comes from ready room into a room where you have the patient. You don't need to wait for the patient to come, for the nurse to get and fetch the patient. Everything's prepared for you, optimizing the clinical hands-on time for the dentist. Then we can see, for example, room number 5. There we have a dentist and is calling at the moment for nurse or hygienist. So the dentist has probably entered the room and does need assistance. So our system puts up all these requests. As we can see, there's one request for room number 6. It has been requesting for 3 minutes, and at the moment it has been named to the matching resource that has been available for the longest time. So we call it this FIFO, first in, first out. The one that has been on a break or available longest will always get the next call and patient. And this way the situation rotates and the day goes through. And now in the room, instead of actually competing against the clock, where you have the next patient pushing on, we have a clock, but we have plus and minus buttons where you control this estimate. So if the treatment is 10 minutes or 5 hours, it doesn't really matter when we have the scale. And it's up to the treating personnel to actually estimate this and give the best quality work with the time they need. And this is something often forgotten, that when we have the predetermined 20 or 30-minute slots, we are forcing all of our workforce to perform the same tasks within the same time without giving them any appreciation of how long they have been in the business, how experienced they are. And we expect the same outcome and quality.
So imagine the fact that there is no stress. Nobody is whispering in your ear, "You're 15 minutes late, you're 15 minutes late," for 30 years. How does that sound? And it gives, everybody's input is welcome. If you are new, you need more time to do the quality job that we require of you. You have your time. If you are experienced, you get frustrated if you have to sit and drink coffee all the time because you have no patience. So you do it at your own pace. You keep the pauses when you want. You just inform the machine, "I'm on a pause." This changes the climate totally. This changes the environment in the clinic. Nobody is like this, with a sad mouth. Everybody is happy, and they have the time they need to do that. We use the system only to guarantee the exact flow. We prognose what kind of patients is coming, how many people can we take in. We can close some slots during the day, or we can open more to balance the flow.
So this is the real-time data that we at any point can view what's happening in the clinic. And from management perspective, our biggest job is to remove obstacles. And that's what the system is doing and what we use the data for, to optimize, to continuously develop this innovation and process. And based on all of these estimates and numbers, they're not there just for fun to follow where someone is. But based on these estimates, the system will look into the future, estimate, okay, in 30 minutes, we will have how many rooms, how many doctors, how many nurses, who am I to call next to the clinic from the patient list? And there's a lot of logic and maths that we've been developing for 5 years, predicting how to optimize this flow, minimizing the staff's waiting times, and achieving the under 3-minute waiting time for the customers. That's the system. Then, okay, this is all fine in our own clinic, but what can we use this for? Since 2015, City of Jyväskylä in Finland has been piloting our system in their 10-room dental clinic. And the prestigious Aalto University in Finland has been conducting a scientific study on this, what we can achieve with the same resources, the same patient management system, no change in the existing infrastructure. What's needed for this is identical treatment rooms, should be more or less in place in many places, and then we bring in one additional computer screen, our processes and our system. The implementation for Jyväskylä, for example, was under 1 month. From the order to the day that they started, with training the entire staff how to use this and getting acceptance took 1 month. So this is not a project that needs to be several months and years to get through. And of course, we have the same problem that was talked about earlier, acceptance. How do we get acceptance of the staff of new innovations? And there's something we have done a lot of work with that it's not just me and Heikki talking about this, but in Finland we have the possibility to actually show our clinic to everyone, to see their colleagues, how they work, and even to work at our clinics that we have in Helsinki, I'm going to have in Stockholm also. Based on this Aalto study and Jyväskylä's data, with these 10 rooms, and only by adding this system, they got over 1,500 patients, more patients treated during this 1-year follow-up. Now you can imagine scaling this up to 100 rooms or 10 cities, and we start talking big numbers. have to remember that Jyväskylä is not perhaps the biggest city of all and not comparable to many other cities in Europe or UK, but the same system is there. And we believe that going into bigger clinics, we achieve higher efficiencies and we can eliminate many problems that come with running only 10 rooms. So the follow-up study showed a 26% increase in efficiency. And the numbers that we see are procedures made per full-time equivalent, per working staff. Those went up 26%. Same staff, same customers, same materials, everything. We didn't change the actually hands-on medicine, the clinical work, just the process, removing the obstacles. The procedures per appointment went up 48% because we didn't need to cut down after 30 minutes and take the next patient. We had the time to do it 10 minutes or 2 hours if so needed and if the customer has the time. And also procedures per customers went up because here we can see the fact in Finland that we earlier had the several year-long episodes always going on to the next year, and now we got all done within one sitting. And ultimately this leads to fewer appointments by customer. Instead of always treating the same population, the same customers that are in the queue again and again and again because we cannot get done the episode and needs they have, we now get them treated in one sitting, out of the queue until they have the next problem. And this, for the big vast majority of standard procedures, what we call the bulk earlier, is what we do. Then there's of course the specialist needs where we can refer to satellites and do other things. But for the big bulk, we can achieve significant enhancements in efficiency and reduce the appointments per customer.
Okay, just to be quite clear, this is not a dental program. This is a platform for medical and social services. You can build it up to your own needs. The only thing it does, it controls the flow and the cost. If you're a chief of some operative unit, especially if you have clinics in several areas and you're the boss, you don't know anything what's happening there. You just, let's hope everything goes fine. With this system, you have full control of what is happening wherever. You even have log data so that you can go through the day, what went wrong, and remove the obstacles. If we go to any hospital today and ask the boss there, what is happening here today? Well, we have wards and we have surgery. And at what efficiency are you operating today? Well, what effectiveness? What does it cost? We get no answers because these poor people don't know. 6 months later, we get the auditor's report that this and this happened. In our clinic, we know by the hour, by the chair, by the provider, by procedure, our profitability all the time online. And we don't use that to harass the staff. We use it to optimize the flow. We know so much already about our patient staff that if we have, let's say that we have a 38-year-old male from zip number this and that, ticking this and this and that, we know the guy's shoe size. That's a joke. But we know a lot, and we know enough to control and keep our flow going.
So behind the scenes, we have tons of data, and we're doing big data analyzations, computer learning, all kinds of trendy and sexy stuff. But the end user doesn't need to know that. We need to supply a simple interface, remove the obstacles, and allow the professionals to do what they can and what they want to do. And that's what we have done in Finland, in our own clinics, in the cities, and we have great customer response, customer feedback for this, but also our personnel is truly enjoying working at us. For example, we had some city coming to us for training, and we got the question, how much do you pay to have your personnel smile? well, we don't pay them to smile. They're smiling because they can do stress-free their work.
There was a lady asking a question in the last session, and she said that we need rapid changes, and she got a huge applause. So, here we are. Let's do something. Thank you.
Are there any questions? Sorry, could you repeat? Based on?
Just full of, I've got a very loud voice here. But we can hear. Yeah. Hi, sorry. I was wondering that, you know, all this data analytics that you all do behind the scenes, is that based on the Q theory of flow systems, which a lot of hospital systems use throughout the world? I was just curious to know, or is it something that you all have developed yourselves completely?
We totally trashed all the prior beliefs and systems and just go through rough data, hard data, without any theories or ideas of actually what we're doing. But we needed to change the system. We needed to change the process. Heikki, with a long career in dentistry, had some ideas, but the personnel we have and the IT department worked together for 5 years to achieve what we have today. So no, it's not based on the queuing theory. It's based on our own customer data and continuous development done by the staff doing the work, the nurses, the dentists, and the teams.
And the second part of my question was, sorry to carry this on, you mentioned that your efficiency has increased by 26%.
That was Jyväskylä's.
All right, I'm slightly unclear about your use of the word efficiency, because efficiency is defined as outcomes divided by cost, whereas productivity is defined as output divided by cost, right? And therefore, did your productivity increase by 26%, or did your efficiency increase by 26%?
We stand corrected. Our productivity increased by 26%, our efficiency by 36%.
Right, thanks.
End of the day, Jyväskylä City was able to pay a bonus to the personnel, which is totally unheard of in the public sector in Finland, that you actually give thanks back to the staff. But after this, due to the increased revenue coming from the treatments, there was money left over, and we turned it all into a profit in Jyväskylä. And this was during the first pilot year of the change.
We have a question here.
Thanks very much. I do like the idea of being able to book in with my dentist or any other health practitioner and stay with them until my needs are met, until they deal with my issue, instead of having to long book 6 months, and you never know what could happen within that time wait. I think that's a good idea. However, I'm concerned when it comes to data policing. All this data seems to be out there, and also when it comes to the personal approach, I think most people, especially here in England, we like that one-to-one. And say for a senior citizen who may not be good on their apps, how will you be able to support them and manage them? You know, because face-to-face contact, I don't think we should get away from that totally. And also, my main concern again is isolating people. This data and this new apps is about isolation, and I thought we were meant to be bringing people out in the community and unifying people. How does your organization say to that?
Well, I think that's really important aspect, and we also already discussed this earlier with Heikki. These all great apps coming along and doing just this. We do not see the future where we only have virtual or e-health or online. We absolutely need the clinics, and we need to rationalize what we do in the clinics so that we have the time to meet our customers face to face. And that's exactly what we're doing. We're not minimizing the amount of customers that we have time to meet, but we are actually enabling all of the population to get these services efficiently, instead of just focusing on those who actually can get through the hassle to get to the clinic and get their episodes over and over and over again. When we treat them once, all at once, all the needs in one sitting, we can take in the next customer and in this way also enable the larger population to get to these services.
And there's also one more thing that I would like to point out, that this system is the only system that gives you enough time to spend with the person that you're treating. So you're not, again, harnessed in 30 minutes. If you need more time, you take it. And that's very much appreciated by our patients. There's one more thing that I would like to remind us all, that this is socially responsibility. The corporate social responsibility is also here. Like if let's say that you're a young mother and you are on parents' leave, you have several kids on one row, how do you maintain your professional skills during maybe 4, 5, 6 years? You cannot call to my small private clinic and say, hey, I would like to come next Tuesday for 2 hours and next Wednesday maybe for 5 hours. That doesn't work. But with a big machinery like this, you can call and say in the morning, hey, I would like to come to work for 4 hours in the afternoon. Welcome, we say, and we open slots corresponding to the extra input that we have through you. And that is something we are very proud of. Here is a question. Sorry, this is the last question we can take.
Hi, thank you very
The
much.
other way around, madam.
Oh, thank you very much. The technology rules, eh? Okay, so I just wanted to say, just thank you, and thank you for your point earlier. I just wanted to say, I've had my own dentist, not own, a relationship with my dentist for 25 years, because like probably quite a few people in the room, I wasn't that keen on going to the dentist. And he's seen everyone in my family. And yes, I have to queue and I have to make an appointment, but do you know, the first thing that occurs to me is that I'm going to go and see him. So I just wondered how that works, because when you're talking about social responsibility and also vulnerable people, actually older people, and I'm starting to go into that category rapidly, kind of like the relationships they build with people who are doing quite personal interventions. So certainly in the UK, you know, the UK system for GP, I would say, is going this way, that you can go to a bigger practice and you might get not your own GP, but someone else. So this idea is certainly developing. But from a dentist's point of view, I still like my own dentist, so I just wondered how that works.
Yes, and we respect that, and please continue with your trusted dentist. We are not interfering with that. And I would like to say that when I started this thing, promoted this idea and presented it in Finland, I called to 40 of my closest colleagues and I said that come and let's do this together. Do you know how many of my colleagues joined me? 0. They said, Heikki, you're a mad man. People want to go to the same dentist for ages. They go with their families. You cannot disturb this. Well, now we're going to Sweden because the demand is there. This is the new age. For me, now I'm ready to pay to say when I am being treated. Okay, we have to stop now.
Yes, this of course puts pressure on keeping the quality and level of customer service at the same level, whoever meets you. But also regarding your dentist for 25 years, he or she is not going to be there forever. What are you going to do then? We see a big we see a big change where this is not actually a problem anymore. Thank you.
sometimes there's pointers integrated.
I don't think there is. Sometimes they have integrated units.
Yeah, it's not on that one.
Let's just ask Jan.
Yeah, it would be good.
Some places I've been told ages ago, oh, they're banned.
Yes, because you can blind people or something like that, and blind airplanes.